Good evening and welcome. Thank you for joining us for this evening's program on mental well-being and heart health. We are so pleased to be joined by our speakers this evening, Dr. Padmini Murthy, Professor of the Department of Public Health at New York Medical College School of Health Sciences and Practice. She is also the Global Health Lead of the American Medical Women's Association and Chair of the International Health Section of the American Public Health Association. We're also joined by Dr. Amy Ansell, Associate Dean of Student Experience and Director of Applied Practice Experience of New York Medical College School of Health Sciences and Practice. Before we begin, I just want to give a big thank you to White Plains Hospital, our local Westchester Live Fierce Take Action sponsor. And I also want to remind everyone that we will be taking questions. So if you have questions as the program begins this evening and throughout, please type them in the chat box, and we will be sure to share them at the end during the Q&A and address them there. Welcome, thank you for joining us, and thank you to our doctors this evening for joining us and sharing their time and expertise. With that, I'll hand it over to them.
Good evening, and thank you, Megan. It's great to be here with everybody tonight. And being that this is all about mental health, which is heart healthy, we want you to all get comfortable. Grab a drink, grab a pillow, get in your comfy clothes, and join us. Join us now to learn all about why mental health and its practicing mental health is heart healthy. Next slide, please. So what are our objectives, or what do we want to go over tonight? We're going to speak about the WHO, the World Health Organization definition of mental health. We're going to talk about the Sustainable Development Goals and how they relate to mental health. Simply stated, SDG 3 is good health and well-being for all. And well-being, what do we mean by well-being? Well-being is associated with your overall health, your job, your family. It has to do with economic benefits. Higher levels of a feeling of well-being are associated with decreased health risks. And what that means is decreased health risks make you less susceptible to chronic disease or to diseases like heart disease and other illnesses. And it increases your odds feeling good about yourself, having an overall feeling of wellness, promoting your own mental health, increases your longevity. What do we mean by the concept of health equity? We believe that everyone has a fair and a just opportunity to be as healthy as possible. Health equity means reducing and eliminating any disparities in health or in determinants of what health is all about. Just about a month ago, we were out at White Plains Hospital working with the city of White Plains in a health fair. And there we were working with the community, where the community lives and plays, which is a really good example of promoting well-being, promoting mental health, promoting heart health. You know, there we were with our partners at White Plains Hospital and our students at New York Medical College and the community pulling together to increase health equity as part of the White Plains Healthy Task Force Initiative. American Heart Association is working with Healthy White Plains and communities all over Westchester County and beyond, in order to improve health and to increase your access to good health and this overall feeling of well-being. We're going to describe how mental health intersects with heart health, because if you are really feeling poorly, if you're mentally depressed, if you have a lot of anxiety, there are physiological factors that will increase your hormone levels of cortisol, adrenaline, which will increase your stress factors, increase your blood pressure. And if you're trying to recover from a stroke, it's very common that people will feel depressed because they've just had a stroke. So the more we can look at people through the lens of not just disease, but in terms of promoting health, we will increase well-being and we will decrease overall disease exacerbations. And towards the end of our presentation, we're going to have some recommendations for you. Next slide, please. So what do we mean by mental health? And it's always good to have an understanding of that. It's a state of well-being in which an individual realizes his or her own abilities and can cope with the normal stresses of life, can work productively, and is able to make contributions to his or her community. Next slide, please. So I just love this slide. If you look closely at it, it really talks about the connection between physical and mental well-being. And if you look at all the different components and you can see the way the arrows go around, it really shows the interconnectedness between heart health and mental health and access to care. Access to care is very important. And self-care. We have to take care of ourselves. We have to figure out what makes us feel better because we are actively involved in our own care and taking care of the people that we love as well. And all these factors, which we also think of as the social determinants of health, where we live, where we work, where we play, the communities that we're in, this has a tremendous impact on our physical and mental well-being. Next slide, please. So a few moments ago, I talked about how we're going to connect in our objectives for tonight, the physiological and the psychological outcomes. And this slide really depicts how anxiety, depression, chronic stress, post-traumatic stress disorders, they all lead to potentially stroke, heart failure, cardiovascular disease, metabolic disease, coronary artery calcification, and heart attack. So we want to do things that are going to increase our well-being, whether it's through exercise and nutrition and eating well and doing things that we enjoy and figuring out what those things are so that we can increase our overall sense of well-being, which leads to improved mental health. Next slide. So Dr. Murthy and I are liaisons to the United Nations Academic Impact, and we are a hub for Sustainable Development Goal 3. Now, Sustainable Development Goal 3, and you can see that little green icon at the bottom right, I think it's your bottom right. How does Sustainable Development Goal 3 relate to mental health? So a little bit about the Sustainable Development Goals that were adopted in September of 2015. And they really are very detailed. There are 17 of them, and they're a very important lens into how we promote health. They focus on a broad range of environmental, economic, and social development activities. And they target linking and integrating from each other, and they work globally. One of my favorite expressions that comes from the WHO is you've got to think globally, but act locally. And the SDGs relate to all this. So when we sit together tonight and we talk about mental health, when we work in the community, when we work together, American Heart Association, White Plains Hospital, so many of the projects that American Heart Association is doing out in the community, like their library project, we are practicing what the SDGs are all about. We are thinking globally, we're thinking big picture, and we're acting locally. Next slide, please. So the American Heart Association has done a lot in this area of mental health promotion and awareness. There's a statement that they published in January of 25th of 2021, while we were deep in the throes of COVID. They came out with an overall policy statement about the importance of mental health. Mental health is important to overall health and heart disease prevention and treatment. That is so important for us all to know. I don't know about you, but heart disease is the #1 killer. And when I think back about my own family, sadly, I have multiple members that all passed away from heart disease. So it's important that we practice heart health, and mental health is a key component of that. And the American Heart Association goes on to say that depression and negative psychological health conditions are associated with a less healthy heart and body. If you're optimistic, if you have a positive outlook, it's going to improve your mental health, and you will have a healthier heart and body. I don't know about you, but I'm a big believer. You've got to practice optimism. You've got to wake up. You've got to wake up with a positive attitude, embracing the new day. You've got to roll with resistance, because negative things happen all the time, but you got to roll with resistance. Healthcare professionals are so important to all this. Dr. Murthy is an MD, and she's a board-certified obstetrician and gynecologist, among her other public health notable achievements. I'm a board-certified family nurse practitioner, so I've done a lot working with families. And it is really important that your healthcare professionals look at you, and they look at your family, and they look at you from a holistic standpoint. We're not just treating disease, we're treating psychological health while we evaluate people who are at risk for heart disease. So once again, improving your psychological health, your feeling of control, of your own empowerment, of your own ability to wake up and to make a difference and to be a change agent, to be your own change agent, can lead to a healthier heart and a healthier body. Next slide, please. So mental health during COVID. Wow, we really have all been through a lot. We've had to deal with quarantine. We've had to deal with fear. We've had to deal with loss of financial security. Many people lost insurance. People lost loved ones, social supports, loss of daily routine, and unemployment. And I know that you who are out there with us tonight, there are other things that you could add to this list of how much COVID has impacted you and how it has impacted how you're feeling about things. And we will talk about in this presentation some strategies that you can utilize to overcome or to work at making yourself feeling better. Next slide. So I'm going to turn this over now to my esteemed colleague, Dr. Padmini Murthy, to talk about the impact on mental health nationally.
Thank you so much, Dr. Ansel, and thank you, the American Heart Association, for hosting us tonight. And thank you all for joining us on this cold evening. And just to continue with what Dr. Ansel has described, one of the things, as you can see in the slide, and there's a saying that a picture is worth 1,000 words. So this is it's showing us how much from January to December, you can see 2019, 20% of US adults reported symptoms of depression. And again, from April, you can see there has been a jump. And what I would like to say is, unfortunately, it's not fashionable for people to talk about mental health. There's so much of a stigma. So it's so nice that the American Heart Association is not only stressing health is a true state of physical, mental, and social well-being, but also connecting the links. And it's not, you should not be ashamed to say, oh, but I'm feeling depressed. I'm feeling out of sort. You cannot blame yourself. We have so many stressors. And just as Dr. Ansel described, there are factors like loss of loved ones, employment, but there are also internal factors because the fear factor is very much there because we are really going around in uncharted waters and also dealing with an unknown enemy, which we don't know when it will strike. Next slide, please. So continuing on, and then this was the percentage of adults reporting anxiety. Definitely it's anxious because we are locked in. Our whole social fabric, the very fabric of our existence has been torn, their holes. We are not sure when we'll get back to normal and what the new normal is. So this is some of the impact on mental health nationally. And as we had a slide earlier, it definitely has a psychosocial impact. It impacts your well-being, physical well-being, especially your cardiovascular health, and also the GI health. And our hosts are not going to, mind because I also slipped in your gastrointestinal health. That is loss of appetite, or you are indulging in comfort food, unhealthy food, and what is we call the trigger finger, you put your hand on the remote and you're just switching, turning the channels as opposed to going out and exercise. And we all know that you need at least 30 minutes of exercise per day. But COVID, there are restrictions of going to the gym. You're scared if you'll get something. So it's the multifactorial stressors which are really putting a lot of strain on our hearts. And we'll discuss how can we address this. Next slide, please. So this is really scary picture because I just, in my earlier slide, I told you what's happening in our country. But as you can see, globally, the statistics on mental health are underreported because of the taboo, the stigma attached to it. And unfortunately, there have been almost 280 million, that's over 250,000 people who are globally affected and are in a mental health crisis. But they do not have the resources to deal with it because often the funding has been removed from these places, which offer mental health services or support. And if they're existent, and there's in many cases they're non-existent. And the other thing I would like you to really understand is there has been such a marked increase in the number of suicides globally and even in our own country, and especially among the youth who cannot, they are learning distance, remote learning. They can't meet their friends. So we are all living in a cocoon and social isolation, not by our choice, but because we have been forced to. So all these are really adding to the burden of the mental health crisis locally and globally. Next slide, please. Again, anxiety. This is a major challenge. So what do you do when you're anxious? We all get anxious. It doesn't matter whether you're a politician, you're a physician, you're a nurse, you're a student, you're just, you're a banker. So one of the things which we are recommending and which is proven that you breathe in and breathe out, because the breathing has a calming effect. That is synchronous breathing. Somebody might say, oh, what are these two people talking about? But it's different. It's not the regular unconscious breaths we take in, but when we do this conscious breathing in and breathing out gently to a count, then it has a biofeedback mechanism. It can release your endorphins, which helps you feel better. And these are the endorphins which kind of act as a buffer and our natural mood elevators. Because please remember, I use the term natural. This is within the body. So we are enabling and helping ourselves. Self-help is the best by enabling our body to produce these neuroendocrine transmitters, which are helpful for us. Next slide, please. Depression. This is again a major issue. And unfortunately, if you will focus on the last bullet we have on our slides, depression, ladies and gentlemen, leads to cardiovascular disease. Cardiovascular disease leads to depression. So this is a vicious cycle. For example, anybody who has had a major heart surgery or even a minor heart surgery, one of the things the caregivers are told is make sure they're not left alone. Try to make sure they enjoy what they like doing, because you don't want them to get depressed. This is a challenge we all face as healthcare providers, caregivers, or just people, that somebody in our family, friends has a heart surgery or any major surgery, they feel low down because they feel incapacitated. They feel dependent on somebody. So again, these are some of the things. So what do? Cheer them up, reach out to them, talk to them. You have an elderly neighbor, my daughter, I tell her that she and her friends do that. They reach out to people like, are you doing okay? It might just be a simple message, a text message, or using a social media platform. In full disclosure, we are not promoting any social media platform here, but just to say there's a way of reaching out. Even during this COVID crisis, for example, AHA has done a fabulous job in having seminars like these where we are connecting. So we learn something, we share our experiences. So the connectivity, the humane touch, that is crucial in addressing and promoting mental health, and indirectly also cardiovascular health, because when you're happy, your heart feels less strained. Next slide, please. The other issue we have is during COVID, there have been a lot of studies, and you can see we have our references at the end of the slide, but just to say that, there has been increased alcohol and substance use during COVID, which again, you get into a deeper depression. Your mood gets, you feel low down. So you drink more, you think you'll feel happier. And then it is not good for your heart too, because if somebody is smoking incessantly and having more than 4 to 5 drinks a day. So this is a major issue. And of course, we know at the moment, we also have an O crisis, there's the opioid crisis. So we have the COVID crisis, we have a violence crisis globally, and we also have an opioid crisis in some of the countries like our own here. So this is a challenge. So again, what do? In order not to, to reduce the prevalence of substance abuse, including smoking, alcohol, or other recreational drugs, we promote exercise. By we, I mean the global community, all of us. Why do we exercise? It's not only for physical health, but it's also for mental health. And again, ladies and gentlemen, physical and mental health are so closely connected. Thank you. Next slide, please. So why is mental health important? We've already talked about that, but I just like to focus on one thing. The mental illnesses can really reduce one's lifespan. So in order to decrease or minimize the effects of the negative effects of mental health issues, we need to exercise. Believe in positive thinking. As Amy said, Dr. Ansel, that when you wake up in the morning, have a positive thought, because all this, it does help to kind of make you feel a little better. So, you think, okay, I'm breathing on my own. I'm not on a ventilator. I have a home. I have my family, and so at least I know that I am better off than so many other people. So it's relative, but we need to focus on the positive aspects. Like, I'm drinking from my water bottle. Instead of saying it's half empty, I'm saying it's half full. So the attitude really makes a lot of difference. And this is good for us. It's the best tonic. It's the own medicine. It's our own medicine, because, we empower ourselves. We embolden ourselves to feel better. Next slide. So you can see again the prevalence of mental illness. This is from 2019. And you know what? We still do not have the latest figures. We should be getting them shortly, but I just wanted on to this. So next slide. And I just want to keep the time. And so these are some of the issues we have. We talked about cardiovascular disease and cancer, but can you move to the next slide? Because we need to focus on what the take-home message is. What are our recommendations? So I just want to tell you, I'm on a lot of listservs as we are. So one of the things I got from the World Health Organization this morning, which I just wanted to share with all of you, ladies and gentlemen, is when we're working from home, time management, open communication, and productivity, and take breaks. And if you can't do something, if you're overwhelmed, it's not a weakness on your part to say that, this is, I can't do it. It's not wrong. So we're talking about social protection and social insurance, physical exercise, mindfulness, and kindness. I just want to focus on these two as we're wrapping up, that we need to be kind to each other. It doesn't cost us anything, but we feel good, we make somebody good, a smile, a simple message, and being mindful of putting yourself in somebody else's shoes to see what can we do. And then again, access, education, and next slide, as we're wrapping up. So a healthy heart and a healthy mind. That's why we talk about exercise. And this is what, I'm a yoga practitioner. I love it. The reason I put it up there is not because I do yoga. And the other thing I wanted to share, in New York Medical College, we have a yoga Zoom class for all of us every Monday. And it's so great because it's a great way to promote your health and well-being. And also, this is something we all need to do. Do something you're comfortable with. You're doing it for yourself. Remember, we are healthy for our own selves, our families, and our community. And next slide, as we wrap up. Next slide, please. So, Dr. Ansel, I'm just going to ask you to jump in as I'm wrapping this up. We need to have global changes to attitudes and beliefs. That's why we talk about mindfulness and kindness. And also, last but not least, kudos to the American Heart Association sincerely, for recognizing and promoting the importance of mental health and physical health. So the C and the M are interconnected. That's why on our slides, we had a brain and a heart holding hands. So it's not that mental health is not from the rest of the health, or, cardiovascular health is different. So for the whole body to function effectively, we need to have mental health. For that, we need to understand this important correlation. And a big shout out to everybody. Thank you so much. Amy, do you want to jump in as we wrap up? I think we're running out of time. Next slide, please.
I think you did a great job of explaining it. I just want to add a really important component of mindfulness is really not getting ahead of yourself. A great strategy to controlling stress is practicing being in the moment. Don't start thinking about all these other things that are going on. Practice being in the moment and figure out what makes you feel better. Very often we hear from people, they say, oh, I don't have time, but look at your schedule. Figure out when you can make time, even 5 minutes in terms of practicing mindfulness, being focused, doing breathing, like you said earlier, all those things can help you. What do you like to do? Figure that out and make time for it. It's a priority. Your health is a priority, and you can't be there for others if you're not there for yourself. So thank you. Questions?
Thank you so much. And as you just say, and we turn it over to our gracious host, thank you so much. A big shout out to J&J, that is both Ms. Jennifer Miller and the other Jennifer, and also to Ms. Megan Lucas for all the work and giving us the opportunity, and our own student, Emily Lamarino. Thank you, Emily, in spite of having a family member who was not doing well, she did do some of the research. So self-help, I would just like to end and echo what Amy said. Self-help is the best help. You need to think about yourself. When you are healthy and strong, you can help others. Thank you so much. Over to you, Ms. Lucas.
Thank you, Dr. Murthy. Thank you, Dr. Ansel. What an incredible wealth of information and just some incredible tools. Thank you for sharing this with us tonight. There were some questions in the chat, mostly some wanting to be able to refer back to this. So we will address some of those. I would like to add one thing, because the Heart Association is really focused on empowering people to take a small step to improve their health today. So what is the one thing people can do to help prioritize their mental health and well-being? So I am charging all of our attendees this evening to think about that as they, go into their evening and the rest of their week and the holiday season, which can be sometimes challenging. So I just want to say thank you again to you both. Thank you to all who've attended. And please, please think of one thing that you can do just for a minute or two a day to help improve your health and well-being. With that, I like that. Take a power nap. That's a good one that somebody just shared. Wonderful, wonderful presentation. Have a wonderful evening. Thank you all for attending.
Thank you all so much. Stay healthy, stay safe. Happy holidays from Amy, myself, and all of us at NYMC and AHA. Thank you.
Thank you.
you.